it causes us to have to rethink about how we reposition, how we think about, how we approach the work of our healthcare ministry so that we can continue to deliver care to the poor and the vulnerable and also those communities that we serve. But our values call us to really transform healthcare, and in doing that in a way that improves the health of the individuals and the communities that we serve. We know that in order to do that and live out our mission more effectively, we need to reach more people, especially those that are poor and the vulnerable. And so through that work, we identified what we would consider 5 core pillars.
Welcome to A&M Healthcare Industry Group's What's Your Moonshot podcast series, where world-class healthcare leaders seek to solve big problems. Listen as we talk to today's health system CEOs about the journey to achieve their moonshots.
Welcome to A&M's What's Your Moonshot podcast. My name's Larry Kaiser, and I'm a managing director in Alvarez & Marcel's Healthcare Industry Group. I'm here with my co-host, former Secretary of the Veterans Administration, the Honorable Secretary, Dr. David Shulkin. David, it's my pleasure today to welcome to the podcast the Executive Vice President and Chief Operating Officer of Ascension, Craig Cordola. Ascension, as many of you know, is a nonprofit Catholic health system and the largest private system in the U.S. Their national health system operates more than 2,600 sites, including 142 hospitals and more than 40 senior living facilities. Craig joined Ascension in 2017, and in his role as Executive Vice President and Chief Operating Officer, he oversees the healthcare and business operations of Ascension, including all of Ascension's ministry markets, which serve communities in 19 states and Washington, D.C., as well as Ascension's post-acute services. Craig also oversees consumer engagement efforts and leads the Ascension Environmental Impact Office and the ministry's efforts to achieve net zero carbon emissions and zero waste by 2040. We're glad to welcome you to the podcast today, Craig, and we really very much appreciate your taking the time to do this for us. Welcome.
Yeah, thanks so much. Thank you. Really looking forward to the discussion. Appreciate the invitation.
Greg, thanks again for joining us. I think the obvious question when you are running a health system as big as you are with Ascension is thinking about what life looks like for Ascension after the pandemic, or at least after it begins to really subside. So how are you, as the Chief Operating Officer, thinking about the way that operations are going to have changed for a system like Ascension in the year coming, or even in the next several years coming?
Yeah, it's a great question. Obviously very relevant, just given the history of the past couple of years. And candidly, I think my comments probably could be echoed across the country by most hospital and health system administrators. But there's no doubt that COVID changed our world, and I think has changed healthcare forever, most likely, and has changed leadership, and it has clearly changed how we have to think about how we do work. So, out of the gate, I think we had patient number 3 in our healthcare ministry when COVID hit now 2 years ago. I'm very proud of how Ascension and all of our colleagues and staff responded to COVID. We had 2 commitments from leadership: take care of our patients and take care of our associates. And I'm grateful to say that every day we and our board supported us to show up to do just that through really, really difficult times. At the same time, we know that healthcare over that past 24 months has changed as a result of what we've been through. Volumes are down across the board. Elective procedures have been down across the board. ED volume, by and large, has been down, although that seemingly is starting to recover. We also know that our costs have gone up dramatically during that same time period. Our labor costs have gone up, inflationary pressures as a result. And then what we knew was likely to happen, because we've been talking about it, is this move towards outpatient, more ambulatory. And that has absolutely accelerated through COVID, in particular in the ambulatory surgery space. So all of that said is that clearly a lot of headwinds. And so it causes us to have to rethink about how we reposition, how we think about, how we approach the work of our healthcare ministry so that we can continue to deliver care to the poor and the vulnerable and also those communities that we serve. And so we did embark on a pretty big strategic plan to try to address where we need to go as a healthcare ministry to better serve.
Well, Craig, you've touched upon a few things already, and this focus sort of moving inpatient care to the outpatient setting. Some of that, in fact, has been propelled forward by the pandemic. And as you know, we're talking about Moonshot here. And what are the key elements of Ascension's strategic plan, as you just mentioned, that you've done a strategic plan, and what are some of those focus areas going forward?
Yeah, so we started, we're in the middle of the pandemic. We're trying to understand kind of what we're dealing with today, but also still looking forward. And so in late 2020, we assembled our team to start looking at our strategy for Ascension. And honestly, it was one of the first times, if the first time, we had a unified strategic plan across all of Ascension. And coming out of that, of course, we're going to stick to our mission and vision and values of our organization. That absolutely remains unchanged. But our values call us to really transform healthcare. And in doing that in a way that improves the health of the individuals and the communities that we serve. We know that in order to do that and live out our mission more effectively, we need to reach more people, especially those that are poor and the vulnerable. And so through that work, we identified what we would consider 5 core pillars. One is around optimizing the clinical enterprise, which is focusing heavily on quality and patient safety, really at the forefront of everything that we do. Enhancing our footprint, looking at some of these ambulatory aspects, virtual care, and looking at our hospital-centric footprint and determining what that should look like. A third pillar was around post-acute and at home, spending a lot of time looking at what's taking place in that post-acute care space. The fourth is around economic models and transitioning from the historical fee-for-service more into value-based. And then the fifth pillar was driving a different approach that is more consumer-centric and providing more flexible options for our patients and families. And then all of that is anchored in better data, IT, and quality infrastructure. And none of that happens without just a completely talented and bought-in workforce, and ensuring that we have a great culture of workforce across all of our ministries. And so that became the framework for what is now our strategic plan as we look forward for the next 3 to 5 years.
Greg, that's a pretty comprehensive plan. I don't think you left anything out of it. All the pieces fit together. And ultimately, though, it is measured, I think, the success on how your patients that use your communities and your system feel about the experience. So when you think about the customer experience or the patient experience, how are you thinking about building a system that really works for patients? How do you know whether you're achieving that? What type of team and infrastructure are you building to accomplish that?
Yeah, terrific question. And I think oftentimes in healthcare, we drop back and think about the patient experience as measured by HCAHPS or the outpatient metrics thereof, and that's a piece of it. But what you're missing is what is the overall consumer experience from somebody that's touching your health system, in our case, our health ministry. And so as part of our strategic plan, you heard my fifth pillar was all around consumer experience and consumer engagement. We had a role that was a vice president of patient experience, but that's not consumer experience. So we have now hired just recently brought in a senior vice president for consumer experience. Underneath that, she has traditional patient experience, but then also all of our contact centers to where it's kind of an omni-channel approach of bringing technology and phone and voice for our patients into a single location or multiple locations, covering regions in our case. And she has a tremendous background coming out of the Disney organization, as well as out of aviation, zero healthcare experience. And so my orientation for her was a bit exhausting because I was educating on all things healthcare. But at the same time, we wanted a different lens. We wanted somebody with a fresh approach, looking at how do you reduce friction, how do you increase access, how do you provide a better overall experience to our consumers, and doing that across all platforms. Doesn't matter how patients and families or community engage with us, we want it to be a very seamless, integrated approach. And then one thing we've already started that now she will pick up, we started to deploy Salesforce across all of Ascension about 6 months ago. So that is an underpinning now of our consumer engagement strategy so that we understand who's calling, what their background is, what touch points they've already had with us across our healthcare ministry, so that we can be better prepared to address that patient or that family member's concerns before we even pick up the phone because we know who they are. And it also gives us a great ability to share information throughout all of our associates that need that information and data so that we can better meet that patient family's needs. And so we're investing pretty heavily to think dramatically different around the consumer experience.
That certainly will be different than the way most people experience healthcare, at least in the past. Another part of what you mentioned a couple times already is this move towards the ambulatory setting. And I know that you've been a big supporter and investing in ambulatory surgery centers. Can you talk a little bit about how that fits into the strategic plan?
Yeah, absolutely. And very similar to what I just described with consumer experience, our bigger play and our investment in ambulatory surgery comes directly out of our strategic plan. We decided that's where we're going to go ahead. Then you figure out what you're going to need to do to execute in that space. We looked at our portfolio of surgery centers, both outpatient owned as well as joint venture partnered. We had about 70 joint venture or independently owned ambulatory surgery centers. If you look at where that market's going and the spend and this migration towards outpatient, we felt like we were dramatically undersized as a result and feel like we need to be probably at around 150 ambulatory surgery centers based on our footprint and geography and size. So you have a question, are you going to build it on your own? You're going to partner, or you're going to buy? And we decided to go in and last year in March, we purchased a portion of Regent Surgical Care. They were very aligned with our mission. They have a 21-year history of providing ambulatory surgery center platforms. And we decided to play big in that space. And that acquisition took place in March of 2021. And by December, we had already closed on 11 new ambulatory surgery centers as a part of that partnership. We expect to double that most likely this year. And so we're transitioning from acquisition or de novo mode into operation mode. We will still be partnered with other joint venture surgery center partners across the country and in this space, but Regent is our platform. It's part of Ascension. It's also third-party commercial, working with other health systems. They do a great job, great to work with, and super excited about our ability to scale up pretty quickly and provide, we believe, a differentiated relationship and partnership with physicians in the communities that we serve.
Well, Craig, you've touched a little bit on this already, and as we've said, the centrality of medical care really is moving out of the inpatient setting into that ambulatory setting, many of these procedures. But then beyond that, we're moving into the home, really. And what's Ascension's vision for home health and even hospice? And why is this important when you start looking at a total episode of care?
Yeah, again, just a great question. This is an area as well that we know that the spend in healthcare, 25% of the Medicare spend is end-of-life care, typically. It's a very fragmented portion of healthcare, unfortunately, right now. We kind of discharge patients from the hospital and off they go somewhere, into a home health. And, most markets, if you're a home health company with 5 or 7% market share, you're the market share leader. It just shows how many people play in that space. And so when we look at that in context of our desire to manage a population, move towards value-based healthcare, provide a better experience and a lower cost for our patients that we serve, we felt like this is another area where we needed to step in and show up differently. About 2 years ago now, we started looking at this space, both hospice and home health, of which we have and had portions of that already within our healthcare ministry, but again, very fragmented. Pulled together an advanced illness thesis and really spent time understanding what does that care experience look like in the home and or through that hospice continuum, and determined we thought we could do it better. And we partnered in this case with a partial acquisition of Compassus, again, another very experienced provider in home health and hospice space. They've been a tremendous partner with us, helping to rethink what that looks like and how we could come together, both Ascension and Compassus, and create something that is a better experience for individuals and families in the death and dying process. It's a huge lift to think differently about that, but one that we believe is very much in line with our calling in Catholic healthcare, something that we couldn't do on our own. So a Compassus was a great connector point for us. That world has changed dramatically because of COVID. So we're kind of resettling back in now and trying to understand what we have in, quote, the post-acute space, and then how we can partner with Compassus to deliver a different experience for both home care and also for hospice care.
And as you point out, when you start moving toward some of these more value-based care contracts, it is really that total episode of care. And so much of that is that post-acute space and what you can do in the home, ideally keeping people out of skilled nursing facilities if you can, and actually keeping them in the home. So it's so critically important.
Yeah,
So,
I'm going to add one more point to that as well. And again, not novel, but just to show what we're trying to do. We have partnered with a company as well, looking at hospital at home in one of our ministries, and just trying to understand what is that going to look like. We think there's utility there. We think it's a lower cost of care. We think we can provide good clinical care in the home. And so we are pressing on that and testing that model a little bit too, because of everything you said, Larry. I mean, it's total cost of care, trying to be better stewards of the spend and the dollar, reduce care and improve quality, which is really why we should be here.
Well, you've shared a lot with us today, and one of the areas that I know is important to the ministry is Ascension's focus on environmental sustainability and stewardship. Tell us a little bit about where you're going in that direction, and I know you have some goals set for where you want to be a number of years from now.
Yeah, this has been a lot of fun work, and again, our ministry has been doing this work for 20 plus years. And as I moved into this role in 2019 and visiting with our CEO, Joan Pichike, had an interest in trying to drive this work a little bit more. And he was greatly supportive, as was our board, which was fantastic. And so based on that, we paused because of COVID for about a year. We finally picked that up middle of last year and came out and got very organized. And we want to be in a leadership position in healthcare and achieve a net zero carbon and net zero waste by 2040. We spent a lot of time internally talking about what does that really mean and can we achieve it? There's capital investment, there's infrastructure, there's P&L investment, and we felt it was the right thing to do as part of our calling. At the same time, we think it's the right thing to do in the communities that we serve, and it's the right thing to do broadly for the environment. And so very excited about that work that we're doing, focusing on scope 1, scope 2, and scope 3 emissions, very delineated outcome metrics that we're driving. It is also tied in toward executive goals, in particular around greenhouse gas reduction over the next 3 years, and also solid waste, municipal solid waste reduction as well. So huge component for our organization and our healthcare ministry, and I think you will see and hear a lot more about that over the course of the next few years as well.
Well, one thing for sure, I think both the vision and the mission of Ascension are very clear. It's very, very clear where you want to be. You clearly also have the size and the scope, as well as the breadth, to truly fulfill all of these pillars that you put forward as part of your strategic plan. So it's really been great to hear today from a huge system like Ascension where you want to be and where you currently are. David, additional comments?
Yeah, Craig, I couldn't agree more with Larry, and thank you for sharing that. I think your goals and where you're going is really exciting, and I think the rest of the country watches when Ascension does things. But what I think is so unique about your approach is that you don't always have to do it alone. In fact, you go out and you look for partners that have been out there doing it and bring in different competencies than a not-for-profit ministry like what you have, and yet you're able to keep your culture and drive those goals. So I think that this is really a model that others should really take a hard look at as well. Thanks for being with us today.
Yeah, well, I appreciate that. I think all of us kind of settle in and find our core competencies and what we can be great in. That's changing in healthcare. All of us are being challenged kind of across all fronts, but we want to stick to the sweet spot on what we're good at, which is providing great high quality care to the patients and communities that we serve. And obviously a huge focus on the poor and the vulnerable in communities and individuals. And where we can do that and we can do it well, we will. And where we need extra help to partner with, we're going to bring in the right partners to do that also.
Great. Well, Craig, we really appreciate you being with us today. Thanks for taking the time.
Yeah.
Great to see you.
Yeah, thanks so much. Thank you.
Thank you.
Alvarez and Marcel, leadership, Action. Results.
It's amazing the size of Ascension and what they're able to do. And obviously, with their faith-based mission, they've made it very clear what the vision is and what the mission is. They certainly have the size to carry out these 5 pillars that Craig specifically mentioned. I think the fact that they've been willing to go out and partner with other entities in these joint ventures, they also, as I think you know, they also have a fund, a venture fund, that they've been using to invest in applications that are useful in the healthcare industry and that really add to the kinds of things that we can do in terms of taking the best care of patients in the most cost-efficient and highest quality setting.
Yeah, Larry, I think you're right. Craig's a very impressive guy. I think you can hear the clarity in which he articulates the specific parts of his strategic plan, and then has the ability to balance out both the mission as well as understanding that you need to have the capital to continue to invest in that mission. And Ascension is one of those organizations that has found that third stream of revenue coming from partnerships that they have with private equity firms and success in both spinning out parts of their organization that frankly now can serve both them as a customer, but other health systems, as well as investing in bringing in systems like what they talked about with the investment in Regents and ambulatory surgery care. So I think that other health systems really can look towards the Ascension model as one path to replicate, to be able to support their own missions.
Yeah, and I think the size gives them the opportunity to do that in multiple markets. And I think, as you pointed out, they really are a model for what other health systems should aspire to. I think that, again, they recognize that there needs to be a shift to the outpatient setting. They recognize that what goes on in the home is critically important, and they clearly have the resources to see that vision through. So
at
I
the
think
same time, there's no guarantee. Past success doesn't guarantee the future. I think Craig started by talking about all of the financial forces bearing down on organizations like theirs as a result of the pandemic, that have been traditionally relying on inpatient revenue. And we all know the staffing in these hospitals is not getting any better, and costs are being driven up in terms of salaries as well as other inflationary costs, as Craig talks about. So this is going to have to, they're going to have to keep their eye on the ball to keep this going in the future.
Well, I think it's a challenging time for all health systems, as you know. I mean, everybody's experiencing the same thing. The standpoint of their cost increasing due to this pandemic, the situation with staffing. You look around the country, most of these systems are absolutely having incredible difficulty keeping staff and recruiting staff. So, yeah, I think these challenges are not going to, I think systems the size of Craig's are not immune, if you will, to the same challenges that are facing even smaller systems. They may have a little bit more depth to rely on, but yes, they are seeing the same challenges and will continue to face the same challenges as we emerge from this pandemic.
Yeah. One of the things that I think that Craig mentioned was that the pandemic is going to change healthcare forever. And, this issue may end up resulting in more consolidation in the healthcare industry. It may be a shift towards, payers having more control. It may not even be clear what the implications of this is for years to come.
Yeah, I would agree with that. I think it was valuable to hear from Craig today. And again, to hear somebody as high up in the organization as Craig is in an organization of this size, and for him to recognize the challenges as well, I think was very valuable. So I think it was a great session, and I think it'll be valuable for our listeners.
Thanks, Larry.